So I hit record too, so we're both recording at the same time.
Yes.
Okay. Kayla, what brings you in today? How do you feel?
Hi, I'm feeling good. I'm struggling with some things in my life. I, I've been working through school and that in and of itself has been a little challenging for me as I haven't been I was in college back when I first graduated from high school. I was in college for 3 years. I almost finished the 4-year program, but I had some medical problems and I had to drop out. And so I was in school to be a neurosurgeon and I was majoring in bio, double minoring in emergency medicine and psychology. And then when the medical stuff came, like it really changed my life around a lot and I had to really focus on getting my health back. And now that I've had many, many surgeries and I am getting my health back, now I'm slowly getting back into school and there have been, you know, multiple things going on in my current life that have made school a little bit harder. So I guess I'm just struggling with like some anxiety and just trying to figure out how like to best advocate for myself and how to stay focused on my goals and not let, the things that happen to me take me down like a bad path.
Okay. So it sounds like you first have some anxiety because you actually acknowledged that you said that. I want to encourage you because even with the anxiety, I heard you also say that life is still good.
Mm-hmm.
Even with the
Yeah.
anxiety, life is still good. Um, I noticed you said that with the work and with the school, there's been some challenges.
Yeah.
Um, in that you were previously already in college for 3 years and some medical issues came up. And because of the medical issues, it kind of put education on a halt for you.
Yeah. Yeah.
And you also mentioned that you had many surgeries, so you had to basically come back from the surgeries and get things back in order. And I heard you say that you also want to figure out some advocacy on how to get back um, or how on this path that you're on right now. Is that what I hear you saying?
Yeah, exactly. Yeah. So like with the surgeries, I ended up having it was only supposed to be one, but the doctor made mistakes and I had uh 32 surgeries in the past 6 years. And some of those were really, really hard surgeries. I actually had a double mastectomy, which is something breast cancer patient. I didn't have breast cancer, but because of the mistakes my surgeons made, my situation was I was going to die if I did not get the double mastectomy. Um, and I had really bad infections that were even spreading to my bones and through my tissues. I even, this is terrible, but I even had holes through my chest. It was really bad. And the surgeon just was not treating me. And I finally got under a surgeon that ended up saving my life just in the nick of time. I had a 12-hour surgery. I had 4 surgeries in one, a double mastectomy, and I had surgery on my abdomen, my ribs, my back, like, because the infection just was spread everywhere. And I had the double mastectomy, and that was really hard. Like I said, I was in school at the time, and I was still trying to push through and, like, be a survivor. Um, and it was really emotional. There's a lot that goes into it. And I was also dealing with a lot of physical pain from the surgeries, which really affects you a lot. And like how everyone struggled with the isolation with COVID. Like for me, I was isolated for literally like 5 years. The only people I saw were doctors. I never saw anyone else. I was just in bed every day or at the doctor's. And it was really hard to stay like focused on wanting to live life, wanting to survive through all that. Like there were times I felt really dark and hopeless, but thankfully I'm in a much better place than that. But you know, it it's been a long time coming. And so yeah, while I'm back in school now and this is my first semester back, I want to stay focused and I want to not let, you know, my worries of failing keep me from like actually achieving what I want to achieve. Sorry, this is kind of emotional for me. Um, but yeah, I want to get better at, communicating my feelings, my needs, things about me. And I think, one way to especially do that is through therapy, getting that. So that is one reason why I'm coming to speak with you because, I want to try to, process some of these things in my life and, really try to stay focused on my goals and not letting, still I've had hardships come in my life and not letting those hardships like overtake me.
Wow. Kayla, you said so much, and I just want to commend you again. Even with all the surgeries, and even with the issues where it was actually life or death. You stayed alive. You push. Like you're still here. You were even isolated for 5 years. And I don't mean to be repeating, but I really
No.
felt you, and I really was listening to you. I even heard you say the double mastectomy. Um,
Hmm.
I can recall my mother. She was a cancer patient years ago. My mother passed away in 2009. I'm not gonna make this about myself, but I understand that because first it was this one, and then it went to the next one, so they had to
Hmm.
remove that. And I remember um, she had to go and get the silicone and everything, and they,
The
told her.
reconstruction.
I mean, but I really just commend you, Kayla. And just listening to you, how you haven't given up. You've even come back to school so that you can get your degree because that's what this is going to lead to. Um, you're getting the degree. It's going to help you to be able to communicate more effectively. And even with this counseling, you mentioned processing. So along with the school, it teaches you how to communicate, but with the counseling, it teaches you how to process. So now it looks like you're learning to know how to communicate and how to process at the same time. You know,
Yeah.
with all of this that's going on. And when I look at you, I can't tell. I can't tell. Um, so what I heard you mention, um, I heard you mention that you mentioned about worrying about failing, but before you said that, you mentioned that about going somewhere with this, and pertaining to the school. So what do you look forward to doing with the education?
So I actually first I want to be an addiction counselor. I want to work in addiction treatment. I think a lot of people um that deal with chronic pain and stuff fall, down the road of addiction. I had an ex who was an addict and they actually sadly overdosed and died last year. And my best friend growing up, who I was very, very close to, also is struggling with a fentanyl addiction. And I want to be able to help people like the people I've known. I want to be able to help people like me who were on pain meds for the surgeries. Like, and after getting my feet wet for a little bit in the addictions counseling, I do want to try to like add I want to look into like possible schooling or accreditation so I can also work with um patients of medical malpractice and negligence, because that was what happened with me. And with that being said, um I really want to help others. And it is crazy how much, while I am all for the medical field, I was a medical professional when all this happened to me. So I know a lot about the medical field. There are amazing people in it, but there are a lot of mistakes that goes down, and it causes people very significant trauma. And people don't often understand, there's not a lot of resources for people who go through such a severe level of trauma. Doctors are the person above anyone we should be able to trust, are doctors. Even when you're scared of your parents, you can go and tell a doctor something, and they're a safe space.
Mhm.
But for me, this doctor turned my life upside down, and he did it actually with many other women as well. I was not the only one. And so it like it just is something where, of course I'm not happy about what I've had to go through. It's been very challenging, and my life has absolutely not turned out the way I thought it would or the way I wanted it to. But I still have hope, and I still have a lot of like perseverance about like pushing through, what I go through, not ignoring it, which is why I'm getting therapy. Like, I don't want to ignore these problems. I'm getting therapy with you. I also have some trauma counseling outside of this that I go see on a weekly basis. And I try to really stay on top of things, because my life has been sadly filled with a lot of tragedy. But I think really amazing people and really amazing professionals can come out of tragedy, especially in the counseling field. And that's something I really want to take with me, and to help others. I want, and to give back in this world. Like, there were certain people, I even had a therapist open up to me about her breast cancer. And that's how I got connected with the doctor that saved my life. And I probably would have died if not. And in fact, my doctor told me I would have died if I had not seen him, because they got me in within a week, and he had an 8-month waiting list.
Mhm.
Um, and like within 3 weeks of that time, he did my double mastectomy surgery to save my life. And so uh like I I wouldn't even be here right now if it wasn't for good counselors in the field, not crossing boundaries, but being open and relating to me like you did with your mother. You didn't really go into it, but you relayed to me, and that kind of thing. It's so helpful. It's so helpful to not feel alone in this world and everything you're going through. Because when you are isolated, oh, does it feel lonely? Like, it's very hard to see the light at the end of the tunnel when you're constantly, all you're looking at is medical bills, doctor's office appointments, prescriptions, like when that's your life. And being back in school has really restored um my optimistic side of myself, because like I I used to speak optimistically, but I didn't really believe it. Like, I honestly felt like another medical problem would happen and I would just pass away. And sadly,
Mhm.
I've had a lot of medical problems that have almost taken my life. And that was such a fear for me. And that really held me back from getting back into school. Because I just thought, I probably don't have a future ahead of me. And that was scary. Like,
Mm.
you know, a lot of people in their 20s don't have to grapple with, you know, am I even going to be like alive for the next year? Like, why would
Mm.
I waste money on the education, if I can't use it? But now I've finally gotten to a place after having so many surgeries. I've finally gotten to a place where it's still very hard. I have a lot of chronic pain.
Mhm.
And so, homework's hard. Even sitting up for me is hard. There's a lot of things that ended up getting affected as like side effects of everything that happened. Even the infections, they spread to my bones and my hips and
Mm.
femurs. So I've had to get total hip replacements as well.
Mm.
I had to relearn to walk, everything like it it's been a lot. It's been a lot. And, I just want to maintain the optimism that I am starting to have back, that real optimism that I truly feel. And I want to maintain that. And I think, you know, I'm not likely to maintain it if I don't also like process the things I'm going through, because I slip back into, depression and then thinking I'm gonna fail. But when I come to therapy, I do feel like it helps me to, process more, and it makes it seem like my goals are actually attainable. And that's very encouraging for me.
Oh, wow. I'm proud of you again, Kayla. You've developed your optimism again, even with all the struggle. Schools help you to process, um, the ability to have hope again. And we don't really have too much time left. It's a lot I really want to say. And I just want to say next time we come back, I would like you to share with me, um, if you would like to, the details on your ex. You mentioned that you had an ex that passed away, that actually overdosed. You mentioned a friend of yours was struggling, with certain things, and that you had other tragedies outside of just the health issues that you were facing. I really applaud you because you are resilient, extremely resilient, because you went through things that people are in the grave right now. People have been gone and been long time being mourned, and you hear, so that's something to know in your heart, apart with the hope that you got, but that you are here for a purpose, and you're going to fulfill your purpose. You keep overcoming, you keep making strides. You don't look like what you say you've been through.
Mm.
You know what I mean? You don't look anything like you say you've been through. And I heard you also mention, I kind of wrote down in my notes, that school has restored your hope. I love hearing things like that. Like you have an expectation, that not just that you're going to live, but that you're going to become who you're supposed to be, and you're going to make the impact in the world that you should make. That's a part of being optimistic. That's a part of being hopeful, and school is doing that for you. It sounds to me that you have a wonderful testimony, a wonderful witness to other men and to other women, who go through hardships like you went through. So, as I said before, because we're almost at the 20-minute mark. If you would like to, I would like for you to share about your ex and your friend. And we also want to just go over some solutions that maybe you would find beneficial, that can help you to continue to excel and become more strong and more restored. Would you like to do that?
Yeah, were you talking about doing that right now or next time we meet, or how are you?
Next time we meet.
Okay, yeah,
Next
that'd
time
be
we meet.
great. That'd
Okay,
be perfect.
that'd be
Yeah.
perfect. Wonderful. And it was good talking with you. Okay.
It was great talking with you too. Have a good week.
Okay, thank you. And you do the same.
Alrighty, thank you. Bye bye.
Mhm.